When you look at someone, do you see them constantly twirling their hair like this, or chewing their fingernails, twirling the band around their wrist, or constantly tapping their leg? Those are a few minor signs that can indicate that someone suffers from an anxiety disorder. This topic is very important to me to talk about because I suffer from an anxiety disorder. First off, I would like to define the word anxiety. According to the Cambridge English Dictionary, anxiety is an uncomfortable feeling of nervousness or worry about something that is happening or might happen in the future. Anxiety disorders are the most common of all mental health problems. Research into these disorders has shown that up to 1 in 4 adults will have an anxiety disorder in their lifetime. According to the National Institute of Mental Health website, there are 3 types of anxiety disorder. Generalized anxiety disorder, other known as GAD, panic disorder, and social anxiety disorder. GAD is diagnosed when a person worries excessively about a variety of everyday problems for at least 6 months or more. Headaches or troubling falling asleep may be symptoms of GAD. It affects about 6.8 million American adults, including twice as many women as men. From this graph, you can see that the regular age of onset for GAD is 31 years old. GAD is the blue bar. The next anxiety disorder I'd like to talk about is panic disorder. People with panic disorders may have sudden and repeated attacks of fear, a feeling of being out of control during a panic attack, a fear of avoidance of places where panic attacks have occurred in the past. Some physical symptoms of panic disorders include pounding or racing heart, sweating, breathing problems, weakness and dizziness, and so on. This is a diagram of what happens to the brain during a panic attack. The frontal lobe activity is decreased. Increased brain activity in the thalamus indicating sensory overload resulting in usual perceptions. And brain activity is decreased in frontal lobes causing confusion, disorientation, and the potential for impulsive behavior. The last anxiety disorder I'd like to talk about is social anxiety disorder. People with social anxiety tend to be very anxious about being with other people and have a hard time talking to them, be very self-conscious in front of other people and feel embarrassed, worry for days or weeks before an event where other people will be, and more. Social anxiety usually starts during youth. Without treatment, social anxiety can last for many years or a lifetime. Now that I have told you the 3 main anxiety disorders, let's talk about treatments. According to Anxiety and Depression Association of America, the most effective treatments for anxiety disorders is therapy and medication. There are many different types of therapy a person can go with according to the circumstances of their condition. There is also a variety of medications also. Now that I have explained what anxiety is, told you the types of anxiety disorders, and told you the treatment options, you should have a little more understanding of what anxiety disorders are. And you can also see if you have any of these symptoms. If you do have any of these symptoms, I advise you to talk to your doctor. Thanks for watching.